ACTH stimulatory test or synacting test. This test can be short test or long test, depend on the time. If it is done in the same day, this is a short test. Long test is take 3 days for preparation. Then we do the short synacting test in day 4. The short synacting test is done by take a blood sample from the patient for measurement of cortisol. Then we inject the patient with 250 microgram ACTH intramuscular or intravenous. After the dose, we take a blood sample at 30 minutes and 60 minutes for cortisol measurement. While in long synacting test, in the 3 first days, we inject the patient 1 milligram ACTH intramuscular. In day 2 and 3, we repeat the same dose, and on day 4, we perform short synacting test as we mentioned. Metropone test measures the ability of the pituitary gland to release ACTH in response to decreased blood cortisol level. Metropone inhibit cortisol production by blocking the conversion of 11-deoxycortisol to cortisol by 11-beta hydroxylase. CRH stimulatory test. This test is used to differentiate between secondary adrenal insufficiency due to pituitary and hypothalamic disease. The result, if the disease is from pituitary disease, no response, and when the defect is from hypothalamic lesion, positive response. Plasma renin and aldosterone given an indication of mineralocorticoid activity. Adrenal insufficiency, low level of aldosterone with high renin. So we do these 2 tests together. If the result is low aldosterone and high renin, this is indicate mineralocorticoid insufficiency. Now we are going to talk about the management of the patient with adrenal insufficiency, mainly by hormonal replacement. This replacement either lifelong replacement or hormonal replacement require other hormonal replacement plus other treatment. Lifelong replacement therapy, hydrocortisone and 9-alpha fludrocortisone. Secondary adrenal insufficiency, hormone replacement may also require more definitive treatment, example surgical removal of pituitary tumor. The management of adrenal crisis, adequate restriction, IV fluid, IV glucose, IV hydrocortisone 100 mg, which should be continued for 4 times daily afterward until the patient can take oral medication. In the crisis, we start with the intravenous drug until the patient can take the oral medication. So this is all about adrenal hypofunction. Thank you for good listening, and see you in the next lecture.